everyone. My name is Nicole Gaidish, and I'm going to introduce the finalized PLERP research poster that was completed on behalf of my team members, Shelby, Clarissa, Donna, and myself. We focused our study on gram-negative rod breast cancer wound infection following post-cancer reconstructive surgery. The study data collected for our study came from the Moffitt Cancer Center, and we were extremely fortunate to have had the helping hand of Dr. Green, who is our mentor for this project. And now I will begin our introduction. Patients with breast cancer may be at an increased risk for infection due to their immunosuppression from chemotherapy, radiation, and previous history of surgery. Tissue expander surgeries may develop a wide spectrum of infectious complications. These complications can often result in extending antibiotic treatment, increasing the rate of drug-related complications, and possible removal of the implant if the infection is not adequately controlled. Patients with weakened immune systems and deep wounds are ideal hosts for bacterial, floral, and biofilms. Specifically, patients with breast cancer are the most susceptible to infections caused by gram-negative rods. Evaluating the most common bacterial infections due to gram-negative rod etiology and identifying their susceptibilities may allow clinicians to prevent infections in cancer patients who have received breast reconstructive surgery.
Hi, I'm Shelby, and I'll be talking about the objectives of our project. Our primary objective was to identify the most common gram-negative rod bacteria that cause post-surgical infections in patients that have been diagnosed with breast cancer and have had subsequent tissue expander surgery. Our secondary objectives include identifying antimicrobial regimen used to treat infection due to gram-negative rod bacterial etiology, isolating the definitive outcome of antimicrobial treatment, to identify possible factors contributing to gram-negative bacterial infections, including chemotherapy and radiation, and also identifying definitive antibiotics that were used in treatment. Now I'll be talking about methods of our project. So our data elements of our project included the date it was collected, organism pathogens from blood cultures, antibiotic susceptibilities, cancer treatment therapy, and definitive antibiotic therapy. We retrospectively collected the data elements listed above for gram-negative bacterial infections in breast tissue in patients treated at the Moffitt Cancer Center in Tampa, Florida.
These are the results from our study. The pie graph shows the different isolates from cultures that were collected. Pseudomonas aeruginosa, one of the most virulent of all gram-negative rods, was the most common pathogen, followed by Serratia and Klebsiella species. Other isolates include Stenotrophomonas, Enterobacter species, Proteus, Acinetobacter, and Morganella species. Table 1 shows the antibiotic susceptibilities from the microbiology lab reports. These susceptibilities are from 38 isolates, but only 33 of them had results. The other 5 were excluded from this data. The susceptibilities are in ascending order, with ampicillin, cefazolin, and cefoxitin having the lowest susceptibilities. Cefoxitin, ampicillin, sulbactam, and ceftriaxone each had intermediate susceptibilities, and ampicillin, cefazolin, and cefoxitin had the highest rates of resistance. The graph on the left shows the definitive antibiotics that were used within the 33 patients. Cephalexin, ciprofloxacin, doxycycline, and sulfamethoxazole trimethoprim were used most often, and from what we saw from Table 1, ciprofloxacin and sulfamethoxazole trimethoprim have 100% susceptibility towards the isolates that are gram-negative rods. The graph off to the right shows the number of patients that have had chemotherapy or radiation therapy, and there are some patients that have had both. We decided to look at the amount of patients that have had additional cancer treatment therapies because these are two factors that could have compromised their immune system. As you can see, many patients have elected to have chemotherapy. Not as many patients have radiation therapy. And it's not shown here, but some patients did have both.
So, in conclusion, the study found that most of the common antibiotics used to treat gram-negative breast infections were ciprofloxacin, cefepime, ceftazidime, zosyn, and meropenem, which also showed high levels of susceptibility to all isolates in the bacterial samples. Antibiotics that are used to treat post surgical gram negative breast wound infections should empirically be able to treat Pseudomonas aeruginosa because that was the most common isolate detected, which accounted for about 42.4% of cases. Cephalexin was used in about 40% of cases in this study, and it's also primarily used for its gram positive coverage with limited gram negative coverage, but unfortunately does not cover against Pseudomonas. Some limitations to the study included a time limitation, which limited the amount of patients that could have been included in this study. Other limitations included the access to patient charts and the type of surgery. So, some patients had a variety of surgeries, which included mastectomies, multiple tissue expander surgeries, and breast reconstruction. The clinical significance of this study would allow prescribers to empirically choose an antibiotic regimen based on common bacterial pathogens from previous patients that had the same surgery or have similar medical histories. Further, it also shows trends in different antibiotics that prescribers empirically choose to treat patients, and then the most common definitive antibiotic regimens that are used to treat them later on. So, some future considerations could be how patients that have had chemotherapy or radiation therapy could be compared to those who didn't receive any therapy or who only received one out of the two. And that would help place an emphasis on whether different pathogens were isolated based on those therapies. Another thing could also be looking at patients' age, renal function, and or prior surgeries. Um, Along with other comorbid variables, can also be included in the analysis of pathogens isolated with appropriate treatment section. And these are our references. Thank you.